Hello everyone, my name is Denise Lorenzo, and today I will be presenting on a patient with a chronic kidney disease. My patient is a 72-year-old Vietnamese female married to a disabled war veteran, and they live in a one-bedroom apartment. Sister and brother lives locally and provides social support. Diagnosed with chronic kidney disease 5 years ago, post placement of a nephrostomy tube. She has strong cultural beliefs about her illness, uses herbal medicine, follows the yin and the yang principle. She presented to the hospital with sepsis due to complicated UTI and lobar pneumonia. Medical history includes chronic kidney disease, atrial fibrillation, pulmonary hypertension, seizure disorder, major depression, and paraplegia due to transverse myelopathy. Medications include carvedilol, dilantin, coumadin, duloxetine, Norco, and albuterol. Nursing diagnosis would be knowledge deficit of managing CKD. An intervention would be provide education and symptom management and self-care. Clinical judgment between self-care and treatment demands. Promote ability for self-care to maximize independence and quality of life. We also need to prioritize on personal autonomy to make self-directive choices. She needs education to promote self-care and understanding treatment demands. Barriers to self-care due to limited mobility. She is a paraplegic. She has generalized weakness and physical inactivity due to the recent hospitalization. Risk for inability for self-care due to knowledge deficit and the nature and course of the disease. Language is a barrier. It is a challenge because she only finished high school and she has trouble understanding the treatment plan. Emotionally distressed and anxious about not being ready to go home. Psychological barriers include depression, uncertainty of safe discharge, emotional distress due to family dynamics. The family and the husband doesn't get along. So, our priority patient issues for discharge planning would be the maintenance of the nephrostomy tube and monitoring output, knowledge and monitoring for any signs and symptoms of infection. She came in with a UTI and pneumonia, so we need to teach the patient signs and symptoms, compliance with medications and follow-up appointments, transportation issues for follow-up appointments and coagulation clinic, durable medical equipments, assistance with meals, home health services. Priorities are quality of life and safety, stability of symptoms, and understanding the course of the disease with the necessary interventions. Discharge planning. Patient discharge plan is to go home to the apartment with the husband. Home health services will include RN services to follow up with the nephrostomy tube, make sure it's intact, and make sure that the patient is having a urine output. Physical and occupational therapy will focus on home safety evaluation, and physical therapy will follow up with endurance, physical functioning, while occupational therapy will focus on activities of daily living and also instrumental activities of daily living. There's also going to be a follow-up with urology for nephrostomy check, a follow-up with primary physician for medication review, and follow up with the coumadin clinic for coagulation, where she's going to go and get her PTINR testing. With the medical equipment, she needed a hospital bed, wheelchair, and nebulizer for home use. Nurse case management strategies that we're going to use include a patient level, clinical assessment of health, and monitoring physiological stability of CKD. Need to have the partnership with family for support, for self-care and management. Education in disease management, maintenance of nephrostomy tube, communication with healthcare team regarding medications and treatments. System level means access to healthcare, insurance benefits and managed care. She has a healthcare partners plan, cost management and utilization management, and home health services. Nurse case management interventions at the patient level. We need to assess the patient's clinical health to reduce exacerbation of CKD, educate the patient on symptom management, and monitoring for output in the nephrostomy tube. We also need to provide coaching on the disease process and the treatments for her nephrostomy. We need to develop partnership with the husband and family members and empower the patient to do self-care and self-management of her chronic illness. We also need to establish communication with the therapeutic plan with the patient, family, and the healthcare team to discuss treatment interventions and goals. Nurse case management interventions at system level. Coordinate with the healthcare team and develop partnership to address patients' needs and barriers to access healthcare. This has something to do with her insurance benefits. So we need to utilize managed care insurance provider to avail of benefits, determine her coverage, and at the same time reduce cost. So we need to be looking at her co-payments, deductibles, and services that the plan will pay. Again, assessing financial problems is the cost of not obtaining high-tech medications and equipment. And as I said earlier, they are both financially strapped, so money is an issue. Educating patient also on home health services and community resources available. Utilization review. This is where the case manager reviewed a patient's medical record. Patient's not involved with this, family's not involved with this. So she reviews diagnosis and medications. She verifies insurance coverage, benefits and eligibility, which is she has a healthcare partner plan. Care issues are determined for medical necessity, and care is rendered at the most appropriate level of care and setting, which is for right now, she is at the acute level of setting. Selection also of in-network provider. So it depends on the doctors that are contracted with her plan. Assessment of needs, the length of stay, and anticipated discharge. These are all parts of the utilization review. Quality and safety issues for the patient. Patient has language barrier. That's going to be a challenge for her as far as education and patient teaching. Education also is challenged due to literacy problems. She's only a high school graduate. Patient also belongs to a lower socioeconomic level. Patient and family has family dynamics. Husband is disabled, unable to take care of her. And environmental safety issues, living in a cramped one-bedroom apartment. So these are all the quality and safety issues. Her going home is a problem because of the one-bedroom apartment which has not been maintained by the husband. Nurse case management effectiveness at the patient level. We want to make sure that our interventions are effective at the patient level. So we look at our treatment goals. Were they met in the hospital? It looks like they were met in hospitals because patient did not have an exacerbation of CKD. Also, the patient verbalized understanding of the disease process and was able to demonstrate skill of maintaining the nephrostomy tube. The patient, family, and the whole healthcare team working collaboratively to meet her needs and treatment goals. Patient and family were motivated. Patient felt more comfortable because there was an interpreter that was being utilized to explain all the interventions in the hospital and also upon discharge. So we had positive patient outcomes. Meeting and realization of the patient treatment goals were achieved. Nurse case management at the system level. This has something to do with the healthcare team being able to assess her clinical needs and eliminating barriers to access healthcare needs. Because of her language barrier, literacy problems, and socioeconomic level, it is very hard for her and the husband to access healthcare. They don't know what's going on with their insurance, they don't understand eligibility. So, this is where the case manager really needs to come in to help them and verify insurance eligibility and medical necessity. Patient also understood home health services and availability of community resources after that assistance provided by the patient by the nurse case manager. Home health services were also confirmed, and the patient at this time understood what was going on. She understood her follow up appointments, she understood um, her testing for PTI and are going to coagulation clinic, and she also understood going to the bridge program, which is the insurance clinic post discharge. The nurse case management manager discharge instructions regarding follow-ups were carried out. She verbalized satisfaction and services rendered by her insurance plan. So at discharge, the patient was able to verbalize understanding of her disease process. She knew how to take care of the nephrostomy tube. She understood her follow-up appointments. She understood the whole discharge planning. She understood her community resources like going out for transportation, Meals on Wheels, and other community resources. Um, Patient was happy, the family was happy, and the interpreter was there all the time. So it was very clear for the patient and what she's going to do. So the last slide are my references. I hope that you guys enjoyed my presentation and thank you for listening.